Hi, my name is Heather Weber, and I'm going to be discussing the 3D MRI for osteoarthritis in athletes. So first off, what is osteoarthritis? Osteoarthritis is the most common form of arthritis. Over time, the cartilage at the end of the bones wear down, causing pain and stiffness in the joint. The most common joints it affects are your hands, hips, knee, and spine, and the damage itself over time to the joints cannot be reversed. So how is it diagnosed? Typically, a doctor will order pictures of the joint, and they'll do that by either ordering an x-ray. The issue with an x-ray is unfortunately you're not able to see the cartilage itself, but you are able to see the space between the bones where the cartilage was. They'll also order either a CT or an MRI blood tests, or they also do joint fluid analysis. And then I also have a picture of comparing the x-ray to the CT scan and the 3D MRI. So this is the x-ray. And like I said, you can't actually see the cartilage itself. This is the CT, this is the MRI, and then down at the bottom right is the 3D model. So that's kind of the difference in exactly what you're looking at. Then from there, what is the treatment for osteoarthritis? There are a couple different medications. You can do acetaminophen, ibuprofen, and they also found that Cymbalta can be helpful. You can also do physical therapy, occupational therapy, and then they'll typically use the TENS unit. Sometimes the doctor will order cortisone injections, lubrication injections, realigning bones, or a joint replacement itself. When it comes to diagnosing osteoarthritis in athletes, it's a little bit more difficult because they end up having a higher pain tolerance. With athletes, joint degeneration occurs in athletes through damage to the articular cartilage caused by repetitive impact and loading, and sports that cause blunt trauma to joints for the most part account for the most damage to the cartilage itself. Osteoarthritis in the knees and hips are higher in athletes compared to non-athletes, and it is found most commonly in football players, boxers, MMA fighters, and baseball players due to the repetitive motion that they have and the force on the joints. So how does a 3D MRI help osteoarthritis? They did a study, and in using a 3D MRI machine, it was able to pick up changes over a period of 6 months that weren't detected using a standard x-ray machine or regular MRI techniques. I also spoke with Ms. Heather Linden, the head physical therapist for the UFC, and she said that using the 3D MRI has helped tremendously with early detection with osteoarthritis in the athletes that she has worked with. And in using the 3D MRI, it has helped not only with the treatment, but also getting accurate measurements of how much cartilage is left and if sometimes surgery or full hip replacement being needed to combat the osteoarthritis. So in conclusion, when it comes to an x-ray, CT scan, or 3D MRI, the 3D MRI has shown to be the most effective when it comes to measuring osteoarthritis and also just preventing it as well. Thanks so much.